Hey everyone, welcome back to Superstat, where we break down the latest in laboratory medicine with a splash of clarity, a hint of humor, and zero pipette bias. We're your hosts. I'm Stat Stephanie.
Melody.
I'm Aaron Odie.
A Run.
Oh,
And
crap.
today we're diving into a big one, CLIA, CLIAC, and what deregulation could really mean for the lab bench and beyond.
This is kind of my wheelhouse. I like to think of CLIA as kind of a rule book. It regulates everything from quality control to proficiency testing to personal requirements, how we get reimbursement, lab inspections, kind of that one-all federal catch thing. It's what kind of keeps your tests from turning into guesswork.
Right. And on the other hand, we have CLIAC, right? It was kind of like the scientific conscience behind the policy. CLIAC helps navigate things like test complexity, lab technology advancements, even training standards. And it had representatives across healthcare, including laboratorians, physicians, patient advocates, industry folks, and more than that, it was a pretty diverse group.
But here's the kicker, because as of March of 2025, CLIAC is gone. Dun dun dun.
Dun.
Yes, disband. Done. No longer in service. But why?
Well,
Why?
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 It wasn't because the lab
Fucking
board
Nelson.
didn't need it, right? It's the committee was dissolved under the new federal executive orders targeting advisory groups that aren't mandated by statute. Yeah, so it was considered an ancillary kind of group under this new policy.
Exactly. So now we're left asking, what does this mean for the expert voices that guide laboratory regulations when things like CLIAC actually disappear?
I think we need to recognize there's a growing push in healthcare for deregulation in general, but specifically when we talk about laboratory medicine, we're arguing, that regulation stifles innovation, it increases cost, slows down the ability to roll out new testing methodologies, and, whatever side you're on, it's an interesting discussion.
I mean, you're right. No one's against progress. Well, I mean, we all want innovation, but here's the catch. In laboratory medicine, cutting corners doesn't just affect workflows, it affects lives.
Right. In previous episodes, we've talked about access. So, not just to mention affecting our workflows, but deregulation could also disproportionately impact underserved populations where access to high quality testing is already very limited.
Yeah, you're right. I mean, but what is the right balance? We talk about innovation and regulation in laboratory, but even with the LDT, laboratory developed test debacle with the FDA and the Ballot Act, and that's officially been put to bed, right? Like it's not, they're repealing the FDA's oversight of that and putting it to CMS. But even that, they tried to put more regulation in and people fought back. Like this isn't the right place for regulation because these individuals don't understand. So what is the right balance?
Yeah, it was interesting because CLIAC was, a very transparent group. It was public. And when we talk about, I love that you mentioned AI, because when you talk about lab medicine evolving rapidly, not just AI tools, but LDTs, at-home testing, I don't know that we need more regulation, but we definitely need to have an appropriate level of guidance. So where do you balance that guidance and expertise? Just removing CLIAC now is like dismantling a compass in the middle of a storm,
I agree with that. I mean, it was just everyday lab directors, people from CDC, FDA, different just people, laboratory professionals that are in the trenches that actually know the technology and know where we're going. So for them to kind of cut that kind of cuts away any innovation that we're potentially going to have. And all that ties into, I mean, CLIA is that federal rule book, kind of dictates what kind of money we get back on reimbursement and the care people get. So if you don't have the experts behind it, kind of it loses its wind and it sails.
Yeah, that's a good point. So wasn't a lot of CLIA modernization actually informed by CLIAC recommendations? So what does that mean like long term for the updates for CLIA?
Well, I think that's the point, right? Like, it's not so much that CLIAC was mandated to be there, right? It was more of an open forum type of place, kind of like, you can think like old school Rome, right? Like kind of the forum, right? Where you could kind of walk in and say like, this is kind of what we're thinking, and like, this is what we're hearing on the horizon, and have like a sounding board situation going on, which I do think is really valuable. I don't know how accessible that was to everyone. I mean, it felt accessible if you were in a larger institution. I don't know when we talk about access, how, available it felt to other individuals. I'm not even sure a lot of people know this is happening, to be honest.
Yeah, that was what I was thinking. Just the fact that quite a few people probably didn't know the group existed and that they were providing this guidance. And then it just seemed like they just kind of quietly just dismantled it, didn't say anything to anybody, and just kind of kept going.
Well, that's a good point. So when groups like this are lost or go silent, what do we really lose as a laboratory society?
Well, I think it's, you don't want to say like, well, I don't think I lost anything because I didn't feel it, right? Like I didn't notice. I think though, you'll notice it at the next big thing, like whatever the next big thing is. Like right now, and I think that's AI. Personally, I think it's AI. But what concerns me is that the lab already has limitations on their voice, and we're working to break those silos and get out there and be visible. Why we have the podcast, right? But now we're taking away another avenue for laboratory professionals that are boots on the ground to speak up, and that concerns me.
Yeah.
I'm glad you touched on that. We've been talking about having a seat at the table and accessibility, and it's just one more seat at the table that we're kind of losing, that voice that we're losing. So people may not be aware of it, but you're right. And when the next big thing comes, just like with all the public health cuts, that's when people are going to kind of feel it. And that's when they're going to know, wow, okay, well, we should have funded this more. We should have actually had these professionals here to kind of route things.
Yeah. So moving forward, what do we do? How could we get our input gathered in lab policy, and what takes its place now?
I mean, I wonder if this is a place for like CLIA to have like a subcommittee or something, that functions in this capacity. I'm sure you could restructure it, and maybe in a more cost-effective way. I mean, I don't have visibility to federal budgets. I have no idea. Do you know what I mean? Like what we're spending. But what I can say is that there's probably a role for an advocate organization or advocate subcommittee or something, even if it's a volunteer-based program, perhaps, with like seats you could apply for, similar to like a board on like a chapter or something like that. That may be a good functionality for it. And then you serve, you could have people serve terms, kind of like the council. We serve on the Council of Laboratory Professionals, or we all have at one point in time. And so maybe something similar to that, kind of a structure.
So kind of with this new kind of, not gap, but maybe potentially opportunity, do you think value-based medicine for the laboratory could kind of fill a bit of that guidance that CLIAC kind of gave? Do you think maybe more of a value-based committee or groups of people could actually be helping to guide things a little bit?
I wonder. That's a really good point, because when you lose your seat at one table, sometimes it's a sign for you to build your own table, and maybe not just ask for a seat at someone else's table, maybe build your own, and perhaps one that is more cross-disciplinary and more agile, and perhaps can be more inclusive for all the patient voices. I like that Melanie mentioned our podcast. That's exactly what we're trying to do with this one right here. But I think it's definitely a wake-up call for all of us laboratorians. We need to preserve what we have in place and reimagine what we could do to shape our own futures.
Yeah, I mean, I think if you didn't know it was happening, you have to ask yourself, like, am I involved in my profession to the degree that I should be? Because if you look at this, if it were happened to like physicians or if it happened to nurses, there'd be a lot more up in arms visibility around it. I think people would be rallying the troops, so to speak, a little bit about it, and really articulating it maybe a little bit better. But they have organizations that do that from a value-based approach, and that do that from like a long-term scoping. I think about workforce, right? Like
Mm-hmm.
they see that as potentially impacting their workforce. And so I just wonder, like, what does that mean for us? Like we, as a group, as a whole, are laboratorians as engaged to the level that they should be on these types
Mm-hmm.
of
Well,
issues?
you kind of brought us back to a good place. I mean, how might this, I mean, deregulation in general affect like the workforce qualifications and professional development in labs? What are your thoughts on that?
Okay, so part of me feels like, and this is because of my doctoral like education that's non-MD, right? So I'll just say that I'm biased. Okay, I'll admit that. But part of me feels like in some ways it's good because it allows for maybe that old guard to kind of not present their biases in the conversation, but allow for maybe some new voices to enter the picture. So I think there are some good things with deregulation in terms of like shaking things up a little bit. But at the same time, to your point, you don't want somebody to just walk in off the street and be like, you know what, let's let nurses do testing.
Yeah.
Because, like that's the part where I'm like, is it too far? Like, who's the one being more rigid? Is it CLIA? Because I always feel like CLIA is more rigid than CLIAC.
Mm-hmm.
Like, maybe my perception's wrong, but I always felt like that was more of like the open, like you could kind of throw anything out there, and CLIA was like, no.
Yeah.
So
I mean, it
CLIA was kind of
definitely
that
raises
voice.
question. Yeah, it definitely raises questions for our listeners out there. I love what Melanie said. So, you didn't know this was happening. How engaged are you in your profession? Should you be more engaged? Should you join professional organizations that could potentially unite in advocacy and try to fill this opportunity, as Aaron so eloquently put it? What are the risks out there for us, and as lab professionals, how can we play a role in helping to shape what's moving forward? That's the questions for our engaged listeners out there, Superstat.
Hmm. That's a good question. I kind of feel like getting involved in our different professional societies, it has given me, at least for me, it's given me that voice that you got people to kind of reach out to that are in Washington, that care about the profession, care about what is happening, and are willing to kind of advocate for you.
Mm-hmm.
But without being a part of these groups, you kind of potentially don't get that access. So,
Yeah.
what
Oh, go
what
ahead.
about globally?
Mm.
Would deregulation widen or narrow the gap in testing access and quality between different communities? You kind of touched on that too, that anyone can just kind of, if we deregulate too much, then anyone can just kind of walk in the front door of the lab. And you mentioned nursing, and yeah, a lot of nurses are like, oh, please don't give me something else to do.
Mm-hmm.
If you talk to a lot of nurses, but on a global level, I mean, do you think, and you mentioned too the fact that it does allow new voices to come in, and you mentioned some of the negatives, but what are some of your other thoughts, like even on a bigger scale?
Deregulation is tricky because I think you have to ask the question too, like, are you even regulated? Right? If
Mm-hmm.
we're talking about some like low income, middle income, you know, uh, international areas where they have very remote testing deserts, like they may not have a lot of oversight to begin with because they don't have a lot of infrastructure for that. And I think that's just the nature of the beast. And that's part of why like point of care is such a big push in those areas because anybody could do that, right?
Mm-hmm.
With very little training. And so I don't know. I think where when we talk about maybe different communities, we're talking about maybe more like your, I don't know, man. I think it's a hard question to ask because access and quality are two very separate issues in my mind. Like they're
Mm-hmm.
similar, but they're very different. The challenges could be different depending on the community.
Yeah, I wonder, CLIAC is US based, but it had a global reach. And in particularly when there are those issues, pandemics or bad things like we mentioned, COVID or HIV that impacted the world, it was great to have guidance and kind of a collaborative voice to in that global public health impact. So you wonder, like, what signal is it sending to the global laboratory community when the U.S. steps away in its own advocacy leadership role? You know,
That's good perspective.
what signal that kind of sends about modeling quality assurance across the world?
For me as a microbiologist, it's frustrating because you see all this global funding disappearing and people just losing sight of the fact that it's taking care of Ebola or taking care of the next global pandemic or all this research that we're doing and all this outreach is protecting us back at home, and, along with protecting everybody else in the world as well. And to pull away from that and to be so short-sighted at points is frustrating. And then even just the fact of seeing them based off of studies that might not exist. I heard reports that one of the most, like the latest report from the AHA, or I think it's AHA, that RFK is doing is apparently the report was maybe generated by ChatGPT, where some of the sources weren't real. So what kind of message are we sending there as well? Not to get too political, but just, I mean, if the foundational science that we've known isn't being trusted and we're supposed to be very forward thinking, what kind of message does that send to the globe?
My first thought was that I hope it was the paid version of chat and not the free version.
Not the free version.
I just think about like
subscribe now.
But I mean, I think in general, like since COVID, it seems like we've lost the ability to have like true scientific conversations. You know what I mean? Like even as a profession. And I don't really care what people's political affiliation is. Like we should still be able to have like a conversation. You know what I mean? Like it doesn't matter, and the same thing with like, I think there's a general lack of trust with the scientific community. Like people have lost more trust, which I don't know if we ever gained it back after some of the things, that have happened historically, but like that doesn't help either. You know what I mean? Like I don't know where we go here.
I think it's like CLIAC, why it was able to be cut so easily without people noticing or caring in points because they didn't know, is because that trust is gone in a sense.
Yeah. I kind of feel like they don't think about like, or they feel like it doesn't matter. I wonder if that's what it is. Like there's this apathy within our profession. I feel like just general apathy, and in the public too, but like towards some of these issues, like, well, yeah, they weren't going to listen to me anyway, or my voice didn't count, or you know what I mean?
Yeah.
Well, it brings up a good point. How do we rebuild and reimagine what could be, a new, emerging, maybe more thought-provoking, trustworthy structure within ourselves?
I think we have to learn more and learn more from our peers. Like for me, studying what pharmacy did 25 years ago, 30 years ago, when they kind of reimagined themselves as a care model, and really understanding like and articulating, we're not pill pushers. This is what we do for care. And having a model and building a framework and doing all the things. And now people couldn't imagine their life without an integrated pharmacist.
It's almost something like that shows that lab cares.
Wow.
Like lab cares. Oh, we have that. Yeah.
Let's take our profession in our own hands.
But it's the truth, right? Like we have to. I think at this point, I think we're at the point where we have to. Because no one else is going to, as is very clearly obvious. I think the CLIAC thing makes it obvious. Like we're considered expendable a lot of the time, and unfortunately, some of that's our own doing. I think we have to be self-reflective on that.
Yeah, but very important at the same time.
Yeah.
The landscape is shifting. Trust depends on us being able to be the voice and build our own table and make sure that our future is shaped by those who have compassion and courage and commitment to science and truth and our profession. So we've talked about a lot of things, and I think this is a very needed conversation. We'd love to hear what all of you as listeners think about this. If you haven't heard about it, go out and do a little research and comment on this episode.